So shall I start then?
In the session, key points for participants. I request the participants to post your queries and in the chat box, or you can ask me during the discussion. Honorable expert of the session, team, academic director, faculty members, and my dear students. Good evening, one and all. Leader is one who knows the way, and shows the way. Nurses are performing different roles in different settings of healthcare, education, administration, and the expanded and extended, coordinating all activities efficiently and leading all team members and taking timely decisions in every situation is crucial. With this concept to enhance nurses' ability in all dimensions, we are organizing this webinar. Hence, they are hosting a webinar on leadership and decision making in nursing by Pareto Institute of Nursing, Pareto University. Myself, Jayashree Basava, nursing tutor from Department of OPG, privileged to welcome you all in this webinar. Today we have with us Ms. Priyadarshini John, Madam is Principal of Indian Blood Cross Society at Belpad College of Nursing at Panchini in Maharashtra. I would like to introduce her. Madam worked as staff nurse in pediatric, cardiothoracic, general pediatric in Christian Medical College and Hospital at Perio. Madam had dual responsibility as board in charge in the intensive category and faculty of school nursing, which was Memorial Hospital in Nassau. Madam employed as a legal instructor in MGM Lawrence Nightingale Institute of Nursing Education at Navi Mumbai. Madam served as faculty at Enterprise Business Consultant at Washington at Navi Mumbai. And she prepared, Madam prepared candidate for CG, FNS and NTS RN examination. In 2018, Madam pursued Masters in Medical Surgical Nursing from Christian Medical College at Delhi. Madam served as Dr. D.Y. Patil College of Nursing, Nehru at Navi Mumbai and worked as Associate Professor and Actuary. Presently, Madam serving as a principal at Indian Medical Society, Bell at College of Nursing at Panchgani in Maharashtra. Madam has vast experience, that is 20 years in academic research and administrative work and 3 years in clinical. Currently, Madam is PhD scholar. Madam has organized various conferences and workshops. Madam was finalist and speaker in different workshops and conferences, and one of them was on leadership in COVID. Madam worked as a peer reviewer in the Indian Journal of Continuing Nursing Education at CMC College. Madam also working on editing the model for leadership course for nurses and for manager training course by Christian Medical Association of India at New Delhi. Madam also holding the administrative responsibility like an activist cell, learning management system, alumni association, and NET at Institute. Madam has done publication in various national and international journals. Madam is also actively engaged in various organizations which communicate to the socio-economic upliftment of, of the underprivileged. Madam is national board member of Young Women Christian Association. Madam held the office of president of the Young Women Christian Association of Bombay for the second consecutive years. May I now request Ms. Priyadarshini ma'am to take the lead of session. Shall we?
Thank you, Jayashree, for your kind words. I'm so excited to be here with you all. So, yeah, thanks for sharing my PPT. So, a very good afternoon to all dear students and faculty of Parul Institute of Nursing. At the outset, I want to thank the management and Ms. Jayashree Vasava for giving me this opportunity to talk on such an interesting and important topic, that is leadership and decision making in nursing. What is decision making? If you look back, actually all of us are making decisions. Right now, you have made a decision to be participating in this webinar. You must have thought many things in your mind. You would have said, okay, should I really attend? Is it compulsory? Will there be any marks for attending? Will you get any certificate? Is it mandatory? Or can I just escape? Some of you all wouldn't have joined. So you have made a decision finally to join. Those of you all have joined. So each and every moment we are making decisions. It's part and parcel of our life. Let's look at another example before I start. All of us, when we go and buy a dress, we look at various things before we buy a dress, right? What all? You may look at the color, you look at the quality, you look at the price of it, whether is it really worth spending that money. You will also think whether you really need it. So based on all these are all the around this, you will finally, you look at, okay, is it worth it, or all those cost benefits, all those things you will actually decide, and then finally make one decision whether to buy or not to buy. Okay, now coming to nursing. Nursing again, Jayashree, you can just change the slides. Can you put it in PPT mode so it's easy to? Okay. Now, if you look at even in nursing, decision making is very, very important. Now, when you make a decision, there are so many questions. Okay, can you see in that picture? You can see that person is just wondering. There are so many options available, and then you have a problem and you want to make a decision. So, and then how do we actually go about doing making a decision is what we are going to talk today. Can I have the next slide, please? Okay. Now, when you look at in a nursing scenario, let's look at, you have an unconscious patient who's actually on a NG feeds. Patient is all, we found that the potassium is high. Patient is also diabetic. And now you're wondering, there are some options that you can have. What are the options? You can either give a fruit juice, or you can say, no, I'm not going to give any juice. I'm only going to give IV fluid. Or maybe you can think of some soup, or you want to administer tender coconut water. Now, which is the best option in this whole thing? Considering the patient. Can I have any answers in the chat box? Are you guys there with me? Nobody wants to take it. It's an easy scenario, and we always come across such scenarios in the hospital. So your patient is on NG feeds. Potassium is high. Patient is diabetic. So potassium is high, then fruit juice and tender coconut water is not a good option, right? IV fluids, when there is an NG tube feeds, best is to give a NG feed than an IV fluid. So the best option could be giving, you can go to the next slide, please. It could be administering soup, so that patient's potassium is also not going to increase. His diabetes is also taken care of. Can we have another next example? In the next one, it's more like if you're in a clinical scenario where you are a head nurse or you're in charge of that place, and you found that a nurse has failed to report for duty. So you have options like, maybe you can increase the workload of the existing staff. You can ask a supervisor for some staff coverage. You can help from the registry, whether you can call some extra nurses, or you can call somebody who's actually on off and ask them to join for duty. So again, in this scenario, what could be the best option? Anybody? If you take it as A, B, C, D, which could be the answer? Okay, so can you go to the next slide? So the answer can be a D. So one of the best options in the scenario can be, you call for another extra nurse, somebody who's actually on off, but you can just call them because you need extra hands for duty. Let's go to the next slide. Another problem. Here you find that I'm looking at clinical scenarios because ultimately we are looking at leadership and decision making in nursing. So when you look at a patient who's actually gasping and requires some emergency intervention, what do you actually do? You here again, imagine that you're a staff nurse there, or you're a ward sister there. Will you just take the nurse's place, or you will ask somebody else to cover you, or from another unit you will call? Again, what could be the best answer here? Next slide, please. Maybe one of the best ways is you can ask another nurse to cover during this time so that you are able to deal with the emergency. Okay. Now let's look at, can I have the next slide, please? Now here you are a ward sister, and you found that a doctor and nurse is having a conflict. And then uh, you are wondering what to do in such a situation. You have three options: either order both of them to stop the conflict immediately, or report them to the immediate supervisor, or you can ask them to step into your office, go along with them, and ask them to stay calm or calm them up. What could be the best option? Okay, go to the next slide. Here, I would say the best option is, instead of making a scene in front of everybody, the patients, the best is to take them aside, calm them, and solve whatever is the issue. Next slide, please. Now let's look at what is decision making. When you look at decision making process in nursing, now management functions, some of the management functions are planning, organizing, directing, controlling, budgeting. In every phase, you have to actually take decisions. You're going on making decisions. So uh, for a manager to be an excellent manager, one needs to take decisions, and it should be the right decisions. It's not just deciding, but it should be the right decision so that you're able to solve the problem. And decisions are taken when there is a problem. So ultimately, your decision making skills should be to ensure that you are able to compact the problem. Next slide, please. So if you look at what is the definition for decision making, decision making is a process of selecting best alternative from available set of alternatives. So you have different sets of options, okay? And you are looking at each option and then deciding which is the best course of action. So that is decision making. And if you look at decision making, every moment, every minute, everywhere we are making decisions, okay? It could be a positive decision, it could be a negative one. But here, in this discussion, I would like to see kind of ensure that we all kind of think about how do we make the best decisions. Now, in decision making, there are three activities. First one is the intelligence activity. What do you mean intelligent activity? You are thinking about what is best. What is the best thing that you can do when there is a problem. So you're intelligently deciding. It is not just taking a decision, but you are using your intelligence, in the sense, now you all are doing nursing course. So our education is giving us the ability to decide as to what to do. Okay. As I said in the beginning, that example where if the patient is having high potassium, then the intelligent decision is not to give tender coconut water or not to give fruit juice, because that is already high in potassium. So you are intelligently deciding. Then the next is you're designing the activity. Designing the activity as to, you want to do something, you are planning it in such a way. Again, you're deciding how to go about the whole design. So to finally accomplish that activity, what all other decisions that you're going to take. Then finally is a choice. Ultimately, the end of the whole decision making is you're picking up a choice of all the available options or alternatives. Okay, so it requires, these are the three activities: intelligence activity, designing activity, and choice activity. Next slide, please. Now, when you look at nursing decision making, what are some of the areas that we may have to come across in decision making, specifically in the clinical or the bedside? Now you are looking at a patient. You have to make a decision how the patient is, whether the patient is actually conscious, whether he's just sleeping, okay? Is the patient well, or he's not really feeling good? So you're looking at the patient, you're looking at various parameters and deciding. You have to decide upon the patient's needs. We have to anticipate what all patient needs and then make a decision as to what to do. Then we need to implement the right care depending on what exactly the patient needs. So depending on the patient needs, you're deciding and then implementing what you ought to do. And finally, what are we doing it for? So that we get the best patient outcome, so that the patient is getting well and getting out of the hospital at the earliest. That decisions that we make will help us to have the best outcome of whether patient becoming well or not. Can I have the next slide, please? Now coming to the types of decision making. There are many types. Some of them we'll discuss here. One is intuition. The word intuition means what? It's that gut feeling, something that I feel within me. I don't know why I feel, but I just feel. So I just saw the patient and I felt, no, he's not really looking good. There is some problem. So that means a gut feeling. Okay. You have not even touched the patient or checked the file to see what exactly, but then the look of the patient itself, you kind of feel, okay, there is some problem. That is called as intuition. Okay. Usually when we as nurses, when we are in the bedside for a longer time, we by looking at the patient itself, we are able to make out that there is some problem. Then you call it as uh, intuition or gut feeling. The second type is reasoning. What is the word reasoning means? That means you're giving a reason for what you're doing. So you're logically looking at what is the problem, what is the you're reasoning out. For example, say patient has got fever. So you have checked the temperature, you found that there is fever, the patient is having 102. So you have a reason as to why you need to take an action. Okay, then again you will decide whether you want to give a cold sponging, or you want to give a tepid sponging, or just a ice cap, or you want to give a paracetamol. Okay, but you are reasoning as to what you want to do before you take that decision. Then the third one is a cognitive basis. Cognitive basis means you're critically thinking, you're analyzing the situation. So you're not just out of your feeling you're doing, you're looking at the patient and deciding what is the best thing to do. Let me give you an example. You're in the ICU, and a patient is on a ventilator with a PEEP of 5 centimeters, and you found that slowly the blood pressure is dropping. Now you will critically analyze the situation. Why is the BP dropping? What is the connection of PEEP with blood pressure? So as you are aware, when we apply PEEP, what happens? The amount of blood going into the heart reduces. So what happens? The cardiac output will reduce. So you're critically analyzing the situation and you understood that, okay, the BP is reducing not because of any other problem, because of the PEEP that you have applied. So you're critically thinking, and this is a cognitive basis of taking a decision. Now let's going to the next slide. Let's look at what are the 7 steps to effective decision making. First and foremost, you identify what the problem is. Why are we taking a decision? Because there is a problem. If there is no problem, then there is no decision. Okay, so you first of all have a problem. And when you have a problem, you try to gather a lot of information as to how to solve the problem. It is suppose you want to go from say Gujarat, you want to come to Mumbai. Okay, and what are the different ways of traveling? You can either take a road, you can take a train, you can take a flight. So you have various options available. So you will gather all those informations, how you want to go. Then you will you will gather information as to what time you want to reach, how badly you want to reach, So those informations again is vital for you to take the decision. Then you will identify all the alternatives. What are the different alternatives that I have at hand to reach that particular or solve that particular problem, or uh, do what you want to do. And then you will weigh the evidence. Weigh the evidence, you will look at which is the best option, cost wise which is best, or time wise which is best. Can I take a flight because I really want to reach there, it is a deadline which I have to reach. Then you may just say, okay, cost is okay because I need to reach there on time, so you may take a flight. Or you say, okay, I have plenty of leave, let me just take a train journey, happily go. Okay, so you will look at various and then weigh the evidences. And then among the alternatives, you will finally choose one alternative. So actually decision making ends there. But then it is again, it is a cyclic process. So you again take an action, then you will again review, is that decision good or not? So if at all you again want to change that decision, you will try and change the decision. So these are the 7 steps of effective decision making: identifying the problem, gathering information, identifying alternatives, weighing the evidence, and choosing among the alternatives, taking an action, and reviewing the decision. Okay, going to the next slide. Let's look at the methods of decision making. There are different methods that one can use for decision making. One is the directive. The directive decision making is like, if you can see in the picture, it's like do whatever I say. uh, you are not asking for anybody's help. What you feel, you're just taking that decision. It's another way of saying an authoritative kind of decision. You're not involving anybody else. It is the fastest option that you can take, because you don't want any delay in that action. So if you look at in suppose in the hospital, you find that the patient suddenly goes into an emergency. Okay, uh, you can't be waiting to discuss and then decide what to do, how to do. No, you as a, imagine you're the ward sister there, you will just direct them. Okay, get the defib, get the IV line, give atropine, whatever. Immediately you have to just take those decisions. So it is a directive kind of decision. Then the second method of decision making is consultative. Consultative is where you consult with others. You're not taking a single-handed decision. You're inviting others' inputs, what others are also saying, which will be best. This is a little less risky because you have others also to help you in taking that decision. It's a passive way of involving others also, but ultimately you are the one who's going to decide. You're consulting, but you as a leader, you will decide what is the best way to go forward. Then the third method of decision making is voting. Voting, as you all know, we each one gives their vote, and then you count as to how many have opted for whatever. So you have again various options. Each one votes. Whichever gets the maximum number of votes, you will take that decision. Then the fourth type is consensual. What do you mean by consensual? You are getting the group to discuss and getting recommendations from everybody and agreeing on a particular decision. Maybe some of them are not happy with a particular decision, some are for it. Then you are taking a mixture of everybody's decision, giving some of your points. You're saying no, we'll compromise. Some of them you're saying okay, no, let's take that. So ultimately you are discussing together and taking a consensual decision. So it's like agreeing, ensuring that everybody agrees with whatever finally you're deciding. Then the last one is conceptual. In conceptual, it includes it. You are analyzing the situation, a lot of thinking and contemplating, and you're conceiving a new idea and bringing out, and that is your decision. So you're not asking anybody, but you are thinking on it, getting more inputs about it, and then finally deciding. that is conceptual. So you have directive, which is like an authoritative style, consultative, which is more of a democratic one, voting is again another democratic one, consensual, where you are kind of giving everybody a chance, and a conceptual one where you're cognitively thinking and deciding. Okay, are you guys with me? Okay, shall we go to the next slide? Now let's see what are the techniques used in decision making. I have listed a whole lot, some of them. There are many more, but I thought we will only look at these for now. We will look at each one by one. We have SWOT analysis, decision matrix, cost benefit analysis, Ishikawa diagram, or it's otherwise called fishbone diagram. Pareto analysis is another one, decision tree, then management by objectives, and program or a project evaluation and review technique. So let's look at one by one. Let's come to SWOT analysis. Next one. Next slide. Yeah. What is SWOT analysis? S stands for strength, W stands for weakness, O for opportunities, and T for threats. So here, when you're taking a decision, you are looking at what are your strengths, what are your weaknesses, what are the opportunities available if you take a particular decision, and what are the threats, what can harm you if you take that particular decision. So weighing all these, you will finally take a decision. So ultimately, whatever is your strength, you have to give more weightage to that. Whatever is a weakness, give less weightage or don't attempt things that you are not really good at. And if there is an opportunity, take up that, and combining your strength and the opportunity and ensuring that you are not threatened in that situation. Based on all this, you will decide, and then, you will finally take a decision. So that is SWOT analysis. Next slide, please. The second one is called decision matrix. So here, you have a list of values, which is put in rows and columns, and you're allowing yourself to look at it systematically and identify, analyze the rate of a particular aspect between the value and the information. This is usually useful when you have so many factors to consider when you want to take a decision. Then you can put in all these different criteria. Like, for example, maybe when you decided which college to join, okay, for admission, maybe for nursing, you must have thought of various, you can say, okay, criteria A, how good is a college? Criteria B, how far is it from my house? Then C can be, what is the fees? D can be, how are the faculty? And you can even have like placement, various factors. You will put everything. Then solutions can be different colleges that you have. Sorry. The different colleges that you have.
Hello.
Yeah. Yeah. So the different colleges that you have, maybe in solution 1, 2, 3. And each one you are giving a particular point. Say, okay, distance from my house. Okay, it is very close. So I'm giving 80%. Maybe each one you're giving a different points depending on how you feel. And then you are totaling them. And then the best one you are taking. So that is called as a decision matrix. Okay. The next one is cost benefit analysis. That's again very simple. You're looking at the cost. Something that is very costly, is it still beneficial? Or like if you're buying an equipment, okay, am I willing to spend, how much am I willing to spend? What is the benefit of spending that much amount? So you're looking at the cost benefit ratio analysis of it, and then you're deciding which option to go into. Next one, please. What does this diagram look like? Looks like a fishbone. So because it looks like a fish, it's called as a fishbone diagram or a Ishikawa diagram. Okay. Here what we are looking at, what is a cause and the effect. What is a cause leading to whatever effect? So there are multiple things that can lead to a particular effect. So is the management, is the material, management, the materials that is available, how is the methods, what is the machine. So based on all that, you're looking at what is the cost which is leading to the effect of it, and then deciding what is the best way of action or how do we solve the problem, keeping into all these consensus. So this involves a lot of brainstorming. So like if the head of the institution will call all the others also and have a session, brainstorm as to what is the problem and think about which is the best option available. Can we see the next one? Next slide. There is another example that I've given there. If you look at it, you'll see that the problem is there is low staff morale. Okay. So the whole nursing team, okay, nursing superintendent along with all the ward sisters, are the heads of the wards are all sitting together and deciding, okay, what is the problem? Is it because of lack of? Then they'll say, okay, why is there a lack of training? It could be because of budget constraint. Okay, another problem can be the management. Maybe there is a change in leadership and nobody is interested in following that leader. So that could be another reason. Or it could be some team structure problem, like for example, lack of clear responsibilities. Nobody knows what exactly one is supposed to do. So there is a feeling of insecurity, and therefore, and that is leading to the problem. So all these are finally leading to the effect of low staff morale. So one has to brainstorm. So they all sit together, discuss, and then come to a consensus as to what to do. So this is called as a fishbone diagram, way of deciding. Next slide, please. Uh, this is called Pareto Analysis. Pareto Analysis, it is based on the idea that 80% of the project benefit can be achieved by just doing 20% of the work. Or in other words, if you say 80% of the problem are traced to 20% of causes. I repeat, 80% of the problems are traced to just 20% of the causes. So if you deal with the 20%, your output is 80% benefit. Okay, so that is called as a Perio analysis. So you're looking at what is the root cause of the problem, identifying, listing it out, and then taking the necessary action. Next slide, please. So this again to do with Pareto diagram, where you are listing out different problems and then seeing what are those uh, errors that can happen, and seeing what are the problems and how it is causing. So this is like a 80-20 rule. You can say it is a 80-20 rule, where it is a technique for getting the necessary facts needed for setting the priorities. Next slide, please. The next one is called as a decision tree. What is a decision tree? It is a tool that uses a tree-like model of decision and their possible consequences. Now here we are looking at what are the chance and the outcome of each chance, or the cost of it. How is it useful? If you look at the example that I've given here, uh, now say you finished your training and you're looking at job opportunities. Okay. What are some of the things that you will look at? Maybe you look at what is the salary? Is the salary good? Should I take it? Not take it? How is the distance? Should I travel a lot? So should I take it? Not take it? Or does there any other perks available? So if there are perks, okay, then I can take it. So you are making the whole, so each decision you have options, and then finally you're deciding which option to go, whether to take it or not to take. So this is another way in which you can make a decision. The next one, please. This is called management by objectives. Here, the crux of the whole thing is objective. You're managing things if you're looking at what is your objective. Am I fulfilling the objective? Then I will decide on that option. So, your whole strategy management model aims at improving the performance of the organization by keeping the objective in mind. Clearly defined objectives are there, and you're trying to meet the objectives. So that is called as management by objective. Go on to the next slide, please. This is program evaluation review technique. In short, you call it as PERT. What is PERT? This is actually, it helps us to evaluate how or review our technique, whether we are using the strategic tool and project in management. It helps us to analyze and represent the tasks involved in completing a given project. Let me give an example. All of your fourth year students or third year students must be doing your research in fourth year. So we know when we have to finish the project. Okay. Say that 50, it is written there, is the final time. Okay. That is the time when you are supposed to complete the project. So if you want to complete a project, say in 6 months, you will start looking at backward. So you will put the whole plan. When should I start my research proposal? Then when should I start my maybe the data collection? When will I do the analysis? And simultaneously, what other things has to be ready? So when your tool is ready, then you will also simultaneously see whether your permissions are ready, so that you can start off taking the data collection, so that ultimately you finish your project on time. So this is called as a program evaluation review technique. So you, based on this, you're taking the decisions as to when you're supposed to act on what. Okay, so these are some of the techniques that you can use when to make decisions. Okay, let's go on to the next slide. Now, these we're looking at the decision making framework, or kind of some of the guidelines when you're wondering how to make a decision. There are some of these clues will help you to ultimately take a decision. One is the policies. Every institution, every college, every organization has some policies. So we look at the policy and we'll take a decision. What does the policy say? The policy says something, accordingly we take a decision. Then next one is the procedures. Nursing is full of procedures. So we don't have to think about what to do next, right? We know this is a procedure, we keep doing it. So it helps us in making the decision what to do, because there is a procedure laid out and we are just following the procedure. Then similarly, methods. There are different methods you can do a particular thing. So you're just following those methods and finally accomplishing your task. And so it makes the decision making process very easy. Then another one is rules. Every college, every institution has some rules. So when whatever is the rules that you have laid out, you're making your decision whether am I within the rule of that particular place. Okay, so that kind of helps you to take a decision. Then the next is the strategies. There are various strategies that you can use. So you're based on what is the best strategy of that particular institution, you will decide. Similarly, vision and mission. Each institution has their own vision and mission. That particular, like when I say I'm from Red Cross, so we are more into disaster management. So if there is a disaster, there is no second thought. We will get into that. It is easy for us to make that decision because our vision and mission says that we have to be on the front. Okay, so we jump into action when there is a disaster. So it helps. So this vision and mission of each hospital or the college helps us to take that decision. So these are some of the guidelines or ideas that you can get from how to, when you are fixed as to what to decide. When you are in that question mark, it's easier for us to take a decision when you look at all these in this limelight. Next slide, please. Now, there are certain things which can lead to poor decision making. What are some of those factors that lead to poor decision making? One is inadequate information. When we don't have the clear picture, when we do not know what will happen, or when you don't have adequate information, then it becomes a difficult task to take a decision. When you have information overload, too many people telling too many things, then again you are wondering what to decide. Okay, information overload is also not good. Too many people are taking decision, you're wondering whether to go with X, Y, Z. So then it becomes difficult. Vested interest. What do you mean vested interest? When you have your own interest and you're trying to put your own interest, then it is difficult to take a decision, because that may not be the right decision, because you're looking at what is best for you. Then the next is resistance to change. People on the whole have resistance to change. It's very difficult to change. We all are like that. All of us are fixed in our own minds, and we want certain things in that particular way. Then it again becomes difficult to take a decision, because that change in the decision to take it, it would become difficult. Then no attachment. Attachment in the sense of that passion. See, when you are really into a particular task, and you have that desire to do it, determination to do it, then you have that, then it's easier to take a decision. But when you're not really interested in that, you don't want to really take a decision. So if there is no attachment also, it becomes difficult to take a decision. Next slide, please. We're almost coming to the end. So I was just looking as how do we empower our team to make decisions? See, empowering our team is very important, because it is not only decision making goes in different levels. So each level, if they take a decision, the work output is better. So we need to empower our employees so that they are able to take decisions. Ultimately, when the staff is empowered, when the faculty are empowered, when the students are empowered to take decisions, then it becomes the performance is good. They're able to go that extra mile. They will do anything to accomplish it. They're more productive. They are ready to face those changes. There'll be good communication, because there is an interest in what they are doing, because they are in charge of it and they feel motivated to work. And ultimately, the output would be very good. So we need to allow our team to make the decisions. Next slide. So, in conclusion, it's like, what does a leadership decision entail? Leadership in decision making is about evaluating information and using it to help dismiss some options for action and to choose another instead. So, when you have so many options, you are deciding as to which is the best option to take. Now, if you look at a good leader, all leaders have to be taking decisions, and they are expected to align with the organization core values, policies, mission, vision, goal, and objectives. And external considerations have to be taken in consideration when you are making a decision. And to conclude the whole uh, decision making aspect, the next slide, please. Choosing the right problem solving model, the right mindset, approach, tools, and skills will make all the difference. So when you apply all these knowledge and play it right, you are able to take the best decision. To sum up in one word, the qualities of a good manager, it all comes down to decision. You make a wrong decision, you become a bad manager. You take a good decision, you become a good manager. Okay, I hope this was useful to each one of y'all. Thank you so much for this opportunity again. Any questions, please?
Participants, if you have any questions, you can drop in chat box.
I didn't get you.
I just say, ma'am, that now I'm audible. Am I audible now, ma'am?
Yeah, I can hear you now.
I was just saying to participants that if you have
Yes.
any questions, then you can drop in chat box.
Yes, you can drop it in the chat box.
Okay. So as I see that there is no any questions or no point of discussions from the participants, okay, we'll conclude the session. Decision making and choice distinguish between leader and the followers. So it is your decision that you become a leader or become a follower. That is up to you. That is your decision that makes you a leader or a follower. Thank you, madam, for excellent deliberation. Since there is no question from participant, we'll conclude the session. Behalf of Pareto Institute of Nursing, Perio University, now I take this opportunity to thank you, Ms. Priyadarshini ma'am, for being the source person for the webinar and sharing the knowledge and valuable time with us. Thank you, ma'am.
Thank you.
I would also like to thank Dr. Ravindra H.M., Principal of Pareto Institute of Nursing, Pareto University, and all students for the participation. Once again, thank you all for the cooperation. Thank you, ma'am.
Thank
You can play.